everyone, welcome to Dr. Vibes the Learning Point. In this video, we'll study about renal trauma. Now, I'll give you an OPD case and then you have to approach it. So, there is a 36-year-old female who is approached in a hospital at emergency with a road traffic accident. And she has been hit either say by a car or by a bus. Now, her blood pressure is low, her heart rate is high, she's complaining of flank hematuria, and she has a bruise over the left lumbar region in which the attack by the car or the bus has been made. So the cardinal points from this given case is that there has been an injury in the left lumbar region leading to frank hematuria. There are features of shock, that is, pulse rate is high and blood pressure is low, and there is a bruise in the left flank region. So this triad, that is the hematuria, the features of shock and the bruise, suggests of renal trauma. Now this renal trauma can either be a blunt abdominal trauma or a penetrating abdominal trauma, which are the causes of renal trauma. And I've already discussed what the usual presentation of the patient is. That is the three triad features. Now, you have to manage this case. So the management of such cases will depend upon the level of trauma, will depend upon the hemodynamic status of the patient, and also the mechanism of injury, like whether it has been by a car or a bus or anything else which has caused the renal trauma. Now, what is grade 1? Grade 1 is that the capsule of the kidney is intact, there is subcapsular hematoma, and this is non-expanding in nature. The level 2 renal trauma is the one in which there is injury to the perirenal region. The collecting tubules are intact. This is also a case of non-expanding hematoma. The difference of level 2 from level 1 is that in level 2, lacerations of less than 1 centimeter is present in the kidney, whereas in level 1, there were no lacerations. So, let's move to level 3 renal trauma, in which lacerations more than 1 centimeter is involved. This is also non-expanding. The collecting tubules are intact in this case as well. Now from level 4 onwards, one more point has been added, that here the collecting tubule gets destructed. Obviously lacerations are present because it started from level 3 only. This is a kind of expanding hematoma which compresses the kidney. Obviously, if the hematoma is expanding, then that will compress the kidney. Other features of level 4 are, there is injury to the renal artery or vein, there is urinary extravasation, in level 5 renal trauma, there is shattered kidney and there is avulsions from the hilum of the kidney. Now we come to management of this patient, and as I told you, that depends upon the mechanism of injury, the level of the injury, and the hemodynamic stability of the patient. So before evaluating, we have to go to the diagnosis. USG is not usually recommended here. CCT will take time, so we don't do that as well. We do intravenous spirogram. On the OT table, one shot is done. Apart from that, MRI can also be done. And renal angiogram, that is followed by embolization, is done. So 3 investigations are done: intravenous spirogram, on the OT table, but this is done 10 minutes after the contrast has been injected to see the images properly. Then we have the renal angiogram followed by embolization, and third we have MRI. The management of a case of renal trauma is that any hemodynamically unstable patient from grade 1 to grade 4 or any patient of grade 5, whether it's stable or unstable, you have to manage it operatively. So first, our target is that achieve hemostasis, then you go for renal salvage. If that fails, you have to go for nephrectomy. Now, grade 1 to grade 4, if the patient is stable, then you have to manage it non-operatively. This is all about the topic of renal trauma. What causes it? What are the levels? The presenting points of the patient? How you're going to diagnose it? And finally, how you're going to manage a case of renal trauma.